Hi, it's Dr. Centeno, and this is how to use X-ray or DDR in place of DMX. And the reason for this video is that DMX is not widely available outside the US. So I want you to like, comment, share, and subscribe because that's how we get this information out to more patients like you. So DMX is a great tool. It uses real-time fluoroscopy to basically measure real life movement, and that can help us check for instability. The problem is, while it's pretty available in the United States, it's unavailable in Europe, and there's only really one site that I know of in Canada. So this video is going to go through instructions, whether it's for a patient or an imaging center, on how to use X-ray or DDR in place of DMX and looking for the diagnosis of craniocervical instability so that it meets our strict criteria. So we need the following views. We need a lateral flexion-extension view at end range, very critically important. The patient must go all the way into flexion and all the way into extension. Critical. We also need an open mouth lateral bending view focused on the C1, C2 facet joint, again, to the end range that the patient can accomplish. Very critical. Now in the lateral cervical flexion extension, it has to be a true lateral. The patient, again, must push all the way into full flexion and full extension, even if that causes some symptoms. Because if we don't have that, the study will be invalid. One strategy is to have the patient take some medications that can help with flexibility. Before the examination, we're looking at translation at all levels from C2 through C7. And the Atlantodental interspace also gets measured in millimeters, usually at end range flexion. And then we're also going to look at AP open mouth lateral bending. The mouth should be wide open and the unit adjusted so that the 1-2 facet joint is visualized. Lateral bending must be at full range. We talked about that. The head must not rotate, so it can't do this as the person laterally bends. It has to do that, meaning the head has to stay neutral. And then we're looking for the C1-2 facet joint lateral corner on the side of the lateral bend, and that has to be visible. And the overhang of C1 on C2 is measured in millimeters. This is really where, most imaging centers are going to get confused, right? They're used to doing lateral flexion extension x-rays. Maybe they're not used to pushing the patient, but that's pretty standard. The open mouth lateral bending is really where I think they're going to run into difficulty. So that's why I'm going to give 3 examples here of problems. So as you see here, this is an area with a potential problem. You can see that this joint is nicely crisped up on this AP open mouth view, but you can't really see this joint in the same way. Whereas this one down here, both C1, C2 facet joints are crisped up. So that's what we want. We want the 2 check marks where you can see both of those C1, C2 facet joints very, very crisp. And a second area where there's going to be a problem is in identifying this corner at C1, C2. So it's on the same side, lateral portion of the C1, C2 facet joint, and we have to be able to see that corner. So you can see here, I can't see the corner of C1, C2, but here the corner of C1, C2 is easily visible. So I need this corner to be readily visible with lateral bending. And then, as you can see here, another pitfall is that the patient turns their head, which is pretty common. They do this or they do this when they're laterally bending. And I need the head to stay absolutely neutral while they're opening their mouth, while you're visualizing C1, C2. So this particular issue is important. Again, the head has to stay completely neutral while they're laterally bending, and it cannot rotate one way or the other. And then this is the C1, C2 overhang measurement that we're looking for. We're looking for measurements in millimeters reconciled with actual distance to make sure we're free of any magnification effect of measuring on the film. So in conclusion, X-rays and DDR may be a substitute for DMX and Diagnosing CCI, but only if these strict protocol rules are followed. So I'm happy to look at these images. I'm happy to try to provide any additional information to the imaging center, but we can do this if we can get films just like this. So again, thanks so much for watching. I want you to like, comment, share, subscribe, because that's how we get information like this out to other patients who have the same issues that you have. Thank you.